Good afternoon, morning for some of you on the call. Thank you for joining us on this session of LTCI Sales Bites. My name is Brittany Button, and I'm a long-term care insurance specialist at Art Jetter & Company. Today, we have the pleasure to be joined by the Amada Senior Care Team. We are thrilled to have access to their services provided by them. These include, but not limited to, policy reviews, claims processing, and advocacy calls for your clients. Today, we're going to speak on navigating changes in the senior health market. Now, we do have some handouts included with the presentation, so make sure to download those. One of the handouts is actually a marketing piece which can be customized with your information. If you're interested, contact me after the presentation and we'll be able to get that done. So before I turn it over to the Amada team, if you have any questions throughout the presentation, feel free to type those into the chat box and we'll make sure to get those addressed. So without further delay, I'm going to turn it over to you guys.
All right. Good morning, everyone. My name is Chad Fotheringham, and I'm with Amada Senior Care. We're really excited to be with you today. The purpose of the presentation today is to give you a little bit a deeper context to what's going on with Medicare, with the payment service itself, and even the downstream providers, hospitals, skilled nursing facilities, home health companies, non-medical home care companies like us. And what does that mean to you if you're in the long-term care insurance industry and you sell long-term care insurance, or you have a lot of clients that have those types of policies, or if you're still selling, then obviously this is going to be, we're going to really try to gear this towards you, and that's what we're here for today. So I'm just going to kind of jump right into it, and we'll get going. As I said before, we're really excited to be here. So first and foremost, we're going to talk a little bit about who we are. We're going to talk about the Medicare fund and the program and how it's set up. We're going to talk about some industry trends. We're going to talk about some of the issues with Medicare solvency or insolvency. And then we're going to talk about how we can work together to power partner, and how we can work with you as you sell long-term care insurance, and how you can work with us as we are a provider of care as well. So first, just to kind of give you an idea of who we are, we really have 4 or 5 main services. The first service that we offer, which is kind of key and core to what we do, is non-medical provider of non-medical in-home caregivers. Another thing that we do is we provide care coordination for long-term care insurance policies within that realm. So I'll get into that a little bit later, and we'll talk about exactly how we can work with you. We also offer placement services. What we find is that a lot of people who have long-term care insurance, they, like 90% of the people, do want to stay at home, but there are very social people who want to get out to maybe a assisted living facility. So we do offer that as a service when we meet with the family and we go through their policy, and we do an analysis of what that policy is. And if we find out that they are a very social person, or their budget precludes them from having someone in the home, then we will help them kind of act like a realtor to help find the right assisted living or board and care or memory care for them as well. We also have in-home technology, and we do allow family members to check in through a portal system, which can monitor exactly kind of what's going on in the home with the caregiver. We also have in-home safety devices, the Philips I've fallen and I can't get up. We offer that to many families because a lot of times families may have 4, 5, 6 hours of care a day, but in some cases at night, it's nice to have a little extra protection with some in-home technology. One of the things that I think really sets us apart is our ability to understand long-term care insurance. We've been doing this in depth, working with the long-term care insurance industry. And so any policy or any policy holder that you have that has a policy in long-term care insurance, we can do claims management for them. And what that normally looks like is if they call you and they say, hey, it's time for me to turn on my policy, we can actually do a policy review with them. We'll call the insurance company. We'll go through about a 30-minute questionnaire with the insurance company. We'll help submit the claim, and we'll continue to process that claim for the family. We also do a lot of that with the VA benefits. We specialize in working with VAs, both with the VA aid and attendance, as well as with VA contracted services through VA hospitals. We do have a full medical staff. We have a medical doctor, MD on service. We also have a director of nursing, licensed clinical social worker, as well as RN case managers as well. So that's kind of just give you an idea of who we are. We do service throughout the country, nationwide. We have about 150 different offices throughout the country that specialize in these long-term care insurance claims management services for your patients, or I should say for your policyholders, our patients and our clients. So let's get into why we're all here today. Let's talk a little bit more about the Medicare fund. Basically, there are two main Medicare funds. There's the Hospital Insurance Trust Fund as well as the Supplemental Medical Insurance Trust Fund. Both of those are funded through two separate ways. We're not going to get too deep into that, but it is important to know, and we'll talk a little bit about, a lot of times, people don't necessarily refer to these as the HI or the SMI trust fund. But the payment source behind what we're going to talk about is important, because in many cases, those trust funds are depleting quickly based on the fact that many of the baby boomers who were putting into those funds and paying taxes to help grow those funds are now retiring and starting to take out of those funds. And so we're going to talk a little bit about that and explain what are the risks of that to many seniors out there, but we're also going to talk about the benefit of what that means to you in your ability to sell long-term care insurance. So real quick, I think we all know this, but Medicare is the nation's health insurance program, and it's really geared, the large majority of people are for the people who are over the age of 65. There's obviously also disabled people who are in that program, but I think it's 70%, which we'll explain later, are for retired over the age of 65 people. It's really broken out into four different pots. And the first pot is Part A, which is the hospital insurance, which I'd mentioned before. Part B, which is the supplemental medical insurance, or SMI. Part C, which is Medicare Advantage, which is a HMO version, or it can also be a fee for service, but it's a managed third-party organization managing Part A and B combined for the patient. And then Part D, which is a prescription drug benefit. And in many cases, Part C can also be combined with a Part D. But those are the four basic structures of Medicare, which I'm sure many of you are already familiar with. Also, if you guys do have questions, please feel free to chime in, ask any questions you guys may have. And those will be, when there are breaks, those will be moderated and I can answer those questions. Or you can hold them for the end, and I'll be taking questions and answers for about 10 to 15 minutes at the end. So once again, as I said before, about 70% of all of the Social Security beneficiaries are retired. And with Medicare patients, most of those people are over the age of 65. And really, kind of as we talk about what are some of the current trends in Medicare, it's really important to understand Medicare Advantage is probably a trend we need to speak about. And what I'll say about that is Medicare Advantage continues to grow. About 40% of all Medicare beneficiaries have signed their benefits over to a Medicare Advantage plan. So 60% are still managing that through the fee-for-service or directly through the federal government, but 40% have said, hey, United Healthcare or Aetna or Cigna, I'm going to sign over my benefits to you, and I'm going to basically follow your path and your plan to get my Medicare benefits. Now, we'll talk about some of the ramifications of what's going on with Medicare Advantage, but that is a trend that I continue to see happening. I do believe that we will continue to see more patients sign up for Medicare Advantage as Medicare Advantage is now offering and has been able to offer some greater and supplemental benefits compared to a normal fee-for-service patient. There is right now, trend-wise, a lot of cost shifting going on from CMS or the people who run Medicare over to the consumer and to the carriers. And a lot of that cost of care and you hear a lot of things in Medicare when they talk about value-based care. In other words, what they're really trying to say is we need to save money. These funds are not viable unless we start to change the way we do it. And we've already seen a lot of the shifts go on. The Affordable Care Act, which I'm going to talk about in a little while, has really changed reimbursement for fee-for-service Medicare patients. So in other words, those people who get their Medicare services directly through the government and they carry their Medicare card, their fee-for-service card, they are changing how hospitals, skilled nursings, home health companies are all getting reimbursed. And so what we're seeing is shorter length of stays in all of those Medicare providers silos. And we'll talk a little bit about that. But if you think about that just at first blush, if we're seeing a shorter length of stay average in hospitals and skilled nursings and with home health, then what does that mean? Well, what it means is that people better protect themselves and they better start to look out for their own interests and really seriously consider long-term care insurance policies. It's very important for seniors to understand that the average length of stay in a hospital or skilled nursing 10 years ago was much longer back then. People got much higher levels of care. They stayed in those acute and subacute settings much longer. They returned home much healthier. Well, now with Medicare changes to reimbursement, we're seeing people coming home much earlier, and they're coming home much more acute, and they're needing more care at home. And so people who don't have long-term care insurance, and I'm going to get into the numbers and show you some of what's going on so that you can understand, so that when you go sell long-term care insurance to people, you can be adamant and really understand that Medicare as it was 5 to 10 years ago is not there anymore. I mean, is it there? Yes. Are there going to be issues with the solvency of the fund? Yes. So what are they going to have to do? They're going to have to really start to decrease, and not will they have to, they've already started to decrease average length of stays, and they're really pushing and shoving a lot of those costs back onto the consumer and getting them into the home-based environment much earlier in the process. So this is, I've kind of already started to sneak into my third bullet point here, but we are seeing a lot of hospitals even start to bypass the skilled nursing facility based on reimbursement and especially based on some of the COVID phenomena that happened. We saw a lot of people in skilled nursings have issues with COVID, and in many cases there was a very negative stigma attached to skilled nursing. So we're seeing a lot more hospital to home or SNF bypass strategies. And we'll talk about that a little bit more and what that means. But really, people are getting home earlier and more acute in the process, so they're going to need more help. This is actually an article that was done in Home Healthcare News, and it basically talked about and highlighted the fact that skilled nursing's really got a black eye during COVID. 40% of COVID-19 deaths involve skilled nursing facilities. There was a lot of really negative publicity and press in New York. A lot of patients at this point, what we're seeing, the trend is changing. More and more patients are starting to opt to forego skilled nursing visits, and SNF diversion is the result. And when I say SNF diversion, I'm saying they're going directly home. And in many cases, home health paired with home care is becoming the first choice for patients. And referrals from hospitals are trending more towards home health than they used to be, which was to skilled nursing facilities. So it's really changing. Not only are people moving to home health more, but PDGM, which is the new reimbursement model for home health, has even changed the length of stay and the average amount of care that people get at home with home health. And I'm going to talk about PDGM, which stands for patient-driven grouping model. That's the way that Medicare is now, starting a year ago, paying home health companies and reimbursing them. And I'll talk about that in a little bit. So let's actually dig into a little bit with PDGM. This is actually Seema Verma. She's the head of CMS. And when they rolled out PDGM, this new home health reimbursement model on how they were going to pay home health, I've kind of bolded a couple payments. I bolded a couple statements in here. And I'm just going to kind of read through that and explain my understanding of that. Value-based payment systems, and anytime you hear the phrase value-based, just think cost containment. When you talk about value, it's Medicare saying that's a way we're going to have to save money, and they're really, and she even flat out said it at the end of her statement, ultimately we're here to reduce the cost of home healthcare delivery. And you'll see in the next paragraph, she says the value over volume paradigm is what's going to really have to change. In the past, the more hospitals and skilled nursings billed for their service, the more they got paid. So it was like, okay, well, let's just bill a lot of services, keep people here a long time, and we'll make a lot of money. Well, now this value-based mindset at PDGM is we're going to give you a lump sum of money based on the patient's diagnosis. And actually it's based on a lot of different categories, but I'm trying to simplify it. We're going to give you a lump sum of money. So if you're the hospital or you're the skilled nursing, you're especially in PDGM, if you're the home health company and you get a lump sum of money, if you stay in that home for 60 days, you make the same amount of money as if you stay in that home for 30 days. And actually that's another thing that PDGM did, is it actually moved the reimbursement timeframes from 60 days down to 30 days so that they have to actually re-up if they're going to within 30 days. So what we're seeing is a shorter length of stay of home health companies taking care of people that Medicare is paying for. Why is that so significant to you guys? Because how many times have you talked to a family and said you need to buy long-term care insurance, and that family says, well, I'm not really too worried, you know, Medicare will pay for me, they're going to pay for my hospital, they're going to pay for my skilled nursing, they're going to pay for my home health. And in many cases they associate the home health policy that you're selling them for long-term care insurance as home health that Medicare pays for, which we all know is not the right way to look at it, because what you're actually selling them is now a safety net, which the gap is now widening much more on what Medicare used to pay for and what they are paying for now. I would say one of the key takeaways that I would take away from this slide, it's not on the slide, but I'm going to give you some very key things to understand. PDGM changed the average payment period for home health from 60 days to 30 days. So if people think they're going to get home health on average for 60, 80, 90 days as it was in the past, you used to be able to have a 60-day window and then that home health would re-up. And if they decided that they needed more therapy, they would keep them in the home. Well, Medicare is now saying, look, that 60-day window is now 30 days. You really are going to have a 30-day window to take care of these people, and you're going to have to prove to us at day 30 instead of day 60 that they need more care. So what does that mean? It means that people are going to be left at home. And let me give you an example. Let's say they go from the hospital and they bypass the SNF, as most people are now doing. It used to be they'd stay 21 to 28 days in the skilled nursing, come home and have 60 days of home health. Well, now the average length of stay at a skilled nursing is between 12 and 14 days. And that's even if they go. As I mentioned before, the large majority of patients are opting not to go to skilled nursing. They're opting to go directly home. And if that happens, you've got a 30-day window with home health, which means you're going to have a therapist coming over maybe 2 or 3 days a week. Well, what's going to happen if they need help with bathing or dressing or transferring or toileting? Well, if they don't have long-term care insurance, they're going to have a very hard time paying for that because the costs are really starting to go up with the demand of caregivers at this point. So that's a lot to take in. I'm going to continue on. If you have questions, as I said before, you can either throw them into the question box. Brittany, do we have any questions at this point? Or how are we doing?
Not yet. We've got a little bit of a shy group, but yes, we do encourage questions. So we are monitoring. Please type those in and we'll definitely make sure to get your questions answered.
Okay, great. Well, hopefully people are writing down a lot of key takeaways that they can share with their patients. We are huge advocates of long-term care insurance. I can tell you there's a huge difference in meeting with the family that has long-term care insurance compared to those that don't. In many cases, it can be a very desperate situation with people who need home care, but they just can't afford it. So you guys, please understand how important what you do is in selling long-term care insurance. Be adamant about what you do, because as these changes happen, more and more people without the long-term care insurance coverage will really go, they'll go without, and there'll be some major issues. All right, let's jump in. So this is kind of a funny slide, but it's not funny. All of the new CMS programs or Medicare programs that have been released since the Affordable Care Act or Obamacare, many of them were put into place because we had no choice. The Medicare fund was diminishing. We had to decrease Medicare reimbursement. And so how did we do that? Well, you know, first there was the Hospital Readmission Reduction Program, HRRP. The first thing they said is we need to reduce readmissions to the hospital. The second thing they put into place was the Affordable Care Organization, or ACOs, where they were going to start giving people lump sums of money to take care of people. The next was the Medicare spend per beneficiary. The next was bundled payments. The next was PDGM. The next was PDPM. But basically, instead of me going through each of these programs, let me just give you the takeaway. All of these programs, what they did is,
sorry. I'm going to interrupt just real quick. We do have some note takers on the call. To answer your question, PDGM, again, that's PDGM, that's going to stand for Patient-Driven Groupings Model.
good job, man. You guys are good.
Yep. Sorry to interrupt, but yeah, that was the question that came in.
No, that's great. Yeah, it stands for Patient-Driven Grouping Model. And what that means is that in the past, in-home health or skilled nursing, and PDGM and PDPM are the new reimbursement models for home health and for skilled nursing. And as you write those things down, just the takeaway that I would take away is that nowadays, home health and skilled nursings have a lump sum of money. They're given a lump sum of money, and whether they keep that person there for 60 days or 30 days or 10 days, they make the same amount of money. So what is the natural tendency of those different providers? It's to actually scale the care down and provide less care and make more money because they've been given a lump sum. And CMS uses buzzwords like value-based medicine, but ultimately we don't have the money to provide a 30-day stay in a skilled nursing facility anymore. So we're going to have to actually change the reimbursement model so that people are in there for only 12 or 13 or 14 days. And really the translation of what I'm seeing on the ground on a regular basis is that Medicare reimbursement is shrinking. And it's not necessarily that it's shrinking, for the providers. What it's doing is it's decreasing the length of stay within hospitals, skilled nursing facilities, home health agencies. And so what is that doing? It's actually putting people at home with less Medicare reimbursed services, and people are having to pay out of pocket saying like, well, I thought Medicare was going to cover me. Well, guess what? It is a little bit, but it's going to get you home, and you're going to have to provide care for yourself earlier than you've ever done in the past. And so average length of stays are decreasing across all Medicare providers. And what that means for you guys is that we need to be more adamant about sharing that message with families. When they say that Medicare is going to provide for me, you're going to have to really understand this and say, you know, the average length of stays in hospitals, skilled nursings, and home health are going down. Medicare doesn't have the money that it used to have to spend to make sure that people were 100% well before they went home. Okay, so, and why is this happening? I mean, I think it's important. We have to at least address the elephant in the room, that Medicare's insolvency and some of the projections that have come out say that if you look at the second bullet, Medicare Hospital Insurance Trust Fund will be depleted by 2024. Now, does that say that Medicare is going to go away? Do I believe Medicare is going to go away? No, I don't. I think there'll be emergency legislation that comes into place. The only problem is we are at a major turning point in our society because we're already, $30 trillion in debt. And we already are having inflation rise because of the amount of money that we pumped into the system. And I'm not putting blame on any party, because both parties have infused more and more capital, or I should say, they've infused more and more into that debt or the deficit due to different programs that they're doing. And so the bottom line is that fund is quickly being depleted, and there's going to have to be emergency legislation. But the ultimate takeaway for you guys is that as we get closer to that point, families really need to start looking for themselves. It's not that this is going to happen in 2024. It's already happening. Our average length of stays across all Medicare reimbursement is already going down. Families are coming home sicker and in the need of more care. This is just kind of some other insolvency data, and what I'd have you pay your attention to is the top line: 2026, 2032, and 2034. Basically what we're seeing is the hospital insurance fund is really starting to be depleted. The Social Security Disability Trust Fund also. What we're seeing is kind of the phenomenon of the baby boomers who were all putting into the pot, and now they're all taking out of the pot. And so what we're seeing is that families are going to have to start to prepare for themselves based on that Medicare insolvency, or at least changes that I expect. I think we'll continue to see these services cut more and more out of a necessity because of some of these projections. And quite frankly, these projections have been in place for a while. They've known that this was going to happen. That's why they actually put the Affordable Care Act into place, so that they could start to put these different payment models in place to really decrease the average cost for an average senior over the age of 65. So all these things are kind of telling the same story. So why does this matter to you guys, and what's in it for you, and what's in it for me? I would say, as I said before, Medicare reimbursement will drive shorter length of stays. I think it's really important that you guys, as long-term care insurance agents, understand that. I think it's also really important that you guys start to find power partners. Who are you going to partner with in your local area? Are you going to find home health companies that that now are having their model changed? Are you going to have home care companies? And that's probably the differentiator. We are a non-medical home care provider that provides non-medical services. Home health companies are those that provide more of the medical skilled benefit. But it's important for you guys to be able to partner with people at the local level. We are more than willing to be that partner for you on the local level. As you work with our local offices, they have the ability to go out with you and share this message with other people, so that other people can understand the importance of long-term care insurance. It's really important that we build that partnership on the local level, because we need to speak at hospitals, skilled nursings, home health, independent livings, assisted livings, senior communities, senior centers. People need to know what's going on with Medicare, so that they will be able to protect themselves with long-term care insurance. And you guys are a key component to that, and we're a key component. What we're finding is that non-medical home care is becoming a much more requested and demanded service. And we're also seeing that some of these changes are really starting to hit states like Washington, and there are now other states that are saying not only is Medicare being affected, but Medicaid is being affected. Our state low-income Medicaid program is not going to be able to provide a safety net for all of these patients. So things like in Washington, they said, look, you're either going to have to pay more of a tax on your income, or you're going to have to go get a long-term care insurance policy. I foresee many states, as they start to project out their Medicaid benefits, that they're going to start to put similar things into place, where they're going to start mandating long-term care insurance, either that you purchase that privately, or that you will have to get that through your state, like Washington did. I do see that happening more and more. That's another projection that I see. Okay, what does it also mean for you? I think the more you guys really understand how much more important MedSup is today than it was 3 or 4 years ago. How important is it for a family to have that MedSup? And I do believe that rates for MedSup are going to have to go up, because as that gap widens of what Medicare pays for and what it doesn't pay for, that MedSup is going to become more and more expensive and more important for families to cover the gap, especially for those fee-for-service. And really, that's who buys MedSup, are the fee-for-service people, not the Medicare Advantage, because Medicare Advantage really works all of those services and tries to take a lot of those costs out of pocket for people. Obviously, the SPIA, the traditional long-term care insurance, and hybrid policies, I foresee a real rejuvenation in the market for long-term care insurance. The problem is most consumers don't understand what's really going on, and they don't understand till it's too late, when they find a loved one in a hospital or a skilled nursing facility, and a case manager comes to them and says, you need to go home. And the family says, what are you talking about? My mom or dad isn't even really that well. Who's going to take care of them? Well, are you going to provide home health? And it's like, yeah, we're going to provide home health for 30 days, but that's it. So it's really important. And I think the more that people can look at and kind of sell all the bundle of these different services with the information that we're giving you, and you can really become really more of a consultant to the families, let them know what's going on in the market, and then obviously you guys have the amazing products that you have to sell to them. I think also understanding the claims environment. And when I say claims, I'm talking about long-term care insurance. What we are seeing is more of an aggressive claims management by many of the insurers. And so I think for you guys to have someone like us that can do that claims process for you, we're very good at getting the claims through, and we're very good at educating families on what is a potential claim and what is not. And many times the families have bought a long-term care insurance policy 10 years ago and they forget what's in there. So a lot of times we'll spend 30-45 minutes going through their policy with them, calling their insurance provider and making sure that they know exactly what is covered and what is not covered. We'll also help them fill out those claims for them, and we'll manage the claim throughout the life, because we are seeing that there is, in some cases, there are providers, and when I say providers, I should say there are insurers out there that are making it a little bit more difficult to claim on those policies. And I don't know if you guys are hearing that, but we see it on a day-to-day. And so it's just something you need to be aware of, and we're more than willing to be a partner with you on that. Let us take the claims part away from you, but at the same time, we can be a really good connector as we're doing that claim, and as we get that claim turned on, and as the family kind of like works their way through that 30 to 45 day window, and they start seeing those checks and the reimbursement come in. That's a really key time for us to pass it back to you, so that that son or daughter who we're working with to get that claim approved can be approached about a long-term care insurance policy themselves. All right, another thing is national care coordination. This is a really big thing that we offer for you guys. So we can offer that. Anyone that you have in any area, send it to us. And if we don't have an office in that area, we will actually help facilitate that to another local provider, and we will still help them. Excuse me. We will still help them on the care coordination and the claims process, even if we're not the provider. All right. Another thing that we do offer is educational webinars and co-branding resources. I'm going to show you some of those co-branding resources in a second, because I think it's important when you are selling these policies, or even if you have sold these policies, it's really important to give your current policyholders resources so that they know who to call when they need help on their claims. And we'll give you some resources for that. So what does power partnering look like? You can see here, this is something that we kind of have had some different people ask us about, especially during COVID. There were a lot of people who had long-term care insurance who during COVID, sons and daughters in many cases didn't even know mom and dad would get sick. It used to be you would just run over to mom and dad's house, you would work things together. I think what we're asking people to do at this point is to be a little more proactive. If you have policyholders, you can actually send this to them, and it will help them put a plan into place. If they have a policy, they can actually share the name of their emergency contact. And does that emergency contact have a knowledge that they have a long-term care insurance policy? And if so, do they know that there's a claims coordinator that can help them do that virtually over the phone? So it's another service that you can provide for your current policy holders. It's also a service you can provide for those who are looking at purchasing, just giving them the education. One thing we find is in many cases, sons and daughters who sometimes are tasked with taking care of mom and dad who have dementia and Alzheimer's, they find out later that they had a policy that they didn't even know about. And so it's really important that their key medical power of attorney understand that they have that long-term care insurance and that they have contacts with us so that we can help them in claiming on their policy. Another thing that we can do is just share information. Yeah, these are some really good resources that you can use with your current policy holders, and you can co-brand with us to get in touch with your current policy holders, and it might create another point of contact, even with a son or daughter. And really what happens, that last slide I talked to you about, there's twofold purpose. The first, and I'll go back to it, the first part of that is making sure that those policyholders have a family member connected. But the second part of it is you guys getting to know who that family member is. In many cases, those family members are a prime candidate for long-term care insurance themselves, or for MedSup, or as those people age, they're getting closer and closer to needing those services. And these are other resources you can use to do the same things. As you can communicate with your current policyholders, you can use these resources to get in touch with them, but also find connection and bridges to their sons and daughters. And so we're obviously aware of that. So I'm going to just kind of open it up for questions at this point. It's 11:35. I'm going to have Brittany maybe help me to facilitate, and I'm going to open up my window and see if I can open up the question pane as well. But I don't see any questions at this point. Brittany, do you have any questions, or does anyone want to ask any questions on how we can help you guys?
So I did get a private message, and this is going to be more of commentary, and you might have some opinions on this, but as mentioned earlier, Washington was the first to really implement a social long-term care program. And for some of you on the calls, you might have been involved in this, and if you weren't, we need to take this very seriously, because basically it was either an income tax or you purchase traditional hybrid long-term care insurance solutions. There was some parameters within it, and it almost destroyed the long-term care insurance industry. Once it really got some momentum, the general public was gaining awareness of this. It took a matter of weeks for carriers to actually suspend sales in the states. They were taking on too much business and bare-bone policies in such a short amount of time. They simply couldn't handle the incoming business anymore. And so at one point, for those stragglers who didn't hear about it till it was really too late, I was left with single premium hybrid annuity products. And as we know, not everybody has $100,000 underneath the mattress to work with. Now, since then, Washington has put a pause on the program, trying to work out some kinks. But we do know of at least 12 other states looking to do something similar. California especially, we know, has a task force implemented, but a handful of states are looking to do the same, and hopefully not make the errors that Washington did initially, but it is something you got to speak on now. Chad, were you impacted much on the kind of Washington social program they were implementing?
Yeah, our office up in Washington was, because we work really closely with a lot of the agents that sell up in that area, and so it was I don't even know how to explain it. I mean, it was a boondoggle, and we were trying to do the best we could to share the information, because we do a lot of public speaking in a lot of different environments. You know, we do a lot of CEU programs for hospitals, certified educational unit programs. We do a lot of speaking at senior centers, and we were trying to get the word out, because in many cases, we saw people, as soon as they understood what was going on, when the benefit was understood, that what they were going to charge on an income tax and what they were getting in return, when the people saw what that was, they all flooded to the market. And
Yep.
so it was an absolute like land rush. And so I think, and the reason I bring that up is I really wanted to talk about that across the country, because I do foresee that happening in other states. Obviously, Washington saw things, and the industry saw things in Washington that they need to change. I think that the industry will adapt. They will hopefully come up with some better solutions, and I hope the states will do a better job of putting those solutions into place. I think Washington learned a lot, but I do foresee, because what's going down is Medicare is decreasing what they're paying for. So what does that mean? More and more people, if Medicare is not providing, especially for the low to middle income, especially the low, if you're in a skilled nursing facility and you have no money, or you don't have a home, and your Medicare days run out at day 12, what do? You stay in the skilled nursing facility, and Medicaid picks up. Well, Medicaid is starting to look at that trend, and they're saying, well, hold on one second. We didn't expect for us to have to pay for a lot of this. We had always expected that Medicare would pay for a large portion. Well, as Medicare starts to shrink their average length of stays, Medicaid's getting afraid. They're seeing their budgets getting constrained, and they're going to start saying, look, we're either going to need to take care of this with a statewide solution, which Washington's solution was not a great solution. What it was going to cost the patients, I shouldn't say patients, what it was going to cost the taxpayers who were paying that as part of an income tax, and the benefit that they were going to get was so minimal, people were just like, this is crazy, we're going to go buy our own policies. So I think that other states will do a better job of hopefully normalizing that and making it a little bit better benefit. But if they don't, we better be prepared in our states. And it's going to be a huge opportunity, but it's also going to be a huge potential risk if we can't manage it better than what happened in Washington. So that's what I have to say, but I wanted to at least bring it up because I do foresee it being a trend that other states will start to take on.
Appreciate your comments on there. I know on our side of the coin there, it was definitely an intense quarter, I would say, about a good 4 months of, P&C agents were getting involved in long-term care insurance sales and, trying to make things happen overnight, which just, as you know, in our industry, especially with underwriting, doesn't necessarily happen as smoothly as that. So I do appreciate that. I don't want to take up too much of your all's time today, but just to let you know, for those attending today, you will receive an email after the session. It will have a link for the replay. So if you want to look back at some of those slides and some of those statistics we covered today, you're going to be able to do so. Chad, I want to say thank you for presenting today. And wow, that was a lot of information. I'm probably even going to have to rewatch it myself. So everyone, have a good afternoon. And our team is standing by if you have any additional questions afterwards.
Thanks, Brittany. Appreciate you.